Welcome to Pursuit of Medicine. This is Dr. Memdani. Today, what we'll do is we'll discuss some X-rays and see in your examiners, whether it be INI-CET, NEET PG, MLE. Examiners basically they like asking about your chest X-rays, and because there are some chest X-rays which a basic medical graduate should know, he cannot miss this X-rays. So let's dive in. Now see this X-ray. This is going to be a basic one, and I have this is already labeled, and over here you can see that the lung is collapsed, and you can see the margins. Okay, the pleural margins. You can see the margin, so this should not usually this should not be visible, and you can see this lung is collapsed, and over here the lung markings are absent. So what is this? This is your pneumothorax. Okay, so if this X-ray comes, you should be able to identify in your PG examinations. Now look at this X-ray. Over here you can see something is wrong. It's very blatantly visible that something is wrong here. So what's wrong here? See, I'll show you first on the normal side. On the normal side over here you see this is how a costophrenic angle should appear. Now here it is grossly normal. Suppose in your exam you will find that this angle is blunted like this. Okay? So this angle is flat like this. So your suspicion should go towards pleural effusion. So this is an X-ray of pleural effusion. Now coming to the third X-ray. You can see where is the abnormality. The abnormality is somewhere over here. Now it could be two things. It could be lobar pneumonia, or it could be something else. अभी पहले अपन will first consider lobar pneumonia. Lobar pneumonia, if it was lobar pneumonia, the consolidation would be uniform. ठीक है? It should be uniform like this. Whole thing should be consolidated, whole lobe should be consolidated, but that's not happened. What has happened is that you can see that there are small cavities like this. Okay, so classic upper lobe cavitatory lesions. So your diagnosis should go towards TB. Okay, so this was TB. Now over here with red arrow they have shown that there is some abnormality. Okay, some abnormality. Now this X-ray is very frequently asked, and there are two variations of this X-ray, and the diagnosis gets changed. It gets asked again and again. Examiner's favorite question. This is your lung cancer. Okay, and why do examiners ask it? Because they'll give you this similar X-ray, but and everything is going to appear similar, but over here there is going to be air level. Over here also you will see air level, and if you see that, then your suspicion should go towards aspergillosis. Of course you need to read the history also, whether he has a smoking history, whether he has a fever, or you need to see the age of the patient. All that you need to correlate, but two similar X-rays they get asked. One is lung cancer, one is aspergillosis. Aspergillosis, always remember, aspergillosis can be confused by lung cancer, but aspergillosis, just by looking at the X-ray, what you need to know is it has some air levels in the periphery. So there is a cavitatory lesion, like a solid circular lesion in aspergillosis also, and it will, but that thing won't be totally solid. It will have some air, some black color air will be there over here in the periphery. So that is your aspergillosis, and this is your lung cancer. Now final X-ray, what do you see? You see that something is very wrong over here. The entire lung fields they have become obliterated. Okay, so you can see that there is this diffuse as if consolidated but not consolidated. Okay, so there could not be lobar pneumonia affecting all the lobes. अगर एक lobar pneumonia तो one lobe is affected or one lobe is affected. It's not like that. Over here what you are seeing is there are diffuse opacities. So there is opacity here, everywhere there are diffuse infiltration. Okay, so diffuse infiltration, this is very characteristic of ARDS. Of course, you need to correlate with the history which the question stem has given. Like for example, if they are pointing towards ARDS, they will also point towards something like sepsis or something like infection or something, and the clinical picture, clinical scenario of the patient is going to rapidly deteriorate. Like he was breathing normally 6 hours back, his oxygen saturation was good 6 hours 12 hours back, now suddenly his oxygen saturation is going down, something like that. So always correlate these x-rays with your clinical. But these were 5 basic x-rays which I think everyone should know. Every undergraduate, if you are entering for a competitive exam, you should know these x-rays. Now today we have done 5 basic x-rays which every medical student should know, and if you are preparing for any competitive exam, irrespective of the exam, these kind of x-rays they get asked, these are examiners favorite, and again they keep asking, so you cannot afford to not know these basic fundas. And I guess like, share, subscribe to my channel. I'm new to YouTube, and share these videos with your friends so maximum number of people will get to know of it. I have also recently done a video and explaining the entire acid base disorders from the very basic, and I have used Hindi language wherever possible, and from the very basic I have gone all the way to the your MCQs. So I will linking somewhere over here about the link of that video of the acid base disorders, and also there is a video which I have done explaining the entire biliary system. Link of that video will also be there. All right, bye bye, thank you, stay focused, and keep studying. All the best for your exams.